We founded Rosa for a very simple mission. We believe today that it's difficult to be a patient. And our dream is that patients will be able to manage their healthcare from their smartphone. When we initially launched Rosa, we were in March 2020, and COVID had just started. And at the time, the market was very, very busy, very crowded. There were more than 30 platforms across the country. That means 30 different websites that patients could go onto in order to find and book a health professional. The whole experience around finding and booking a health professional was quite complicated in Belgium. In the course of 3 years, we went from new entrant to the biggest marketplace. Concretely, that means having over 4,000 active health professionals. That's the biggest supply of health professionals in any platform and marketplace in Belgium. We have millions of patients that interact with Rosa over the course of a year. And finally, we manage hundreds of thousands of medical appointments every month. And this volume of activity doubles and triples over the course of a year. We have constant month-on-month growth, which translates in very high brand awareness and recognition, and more word of mouth, which is exactly what you want to be a successful marketplace. One of the most recent achievements of Rosa, this is something that we achieved in 2023, was our ability to upgrade our platform and address the needs of hospitals.
Rosa started to work with hospital more than a year ago because they wanted to create a marketplace that would also, on top of general practitioner, deliver hospitals, which was a very big pain point for patients. Working in the hospital sector is a highly regulated sector with very sensitive data about patients, about treatments. And so it's really tough, especially to come in, to create the access, because hospitals are not willing to open that to anyone, which is a good news for patients and HPs alike. And so really you have to take into account that it will take a bit of time to get there, but once you get there, you have access to what you need to provide the patient value. So to overcome the many challenges at Rosa, the main solution is communication. You want to make sure that the top management is aligned with what we're trying to do. So they need to be behind you to push. And you need to find the right stakeholders within an hospital and within other suppliers. Because in the end, it's all about merging things together to fit everyone's need. And so constant communication is key. And you have to be there, you have to be in person, you have to be responsive.
We launched Rosa knowing that there were already solutions on the market. There were already a good solution in other countries, such as indeed Doctolib in France. There's ZocDoc in the US. That's clearly providing a lot of values. There were already also solutions for finding and booking appointments in Belgium, but we really thought we could provide an extra value and try to fasten the process of digitalization in the healthcare system.
For me, the most quality of Rosa is that it's super fast. For example, I broke my wrist and it was 2 in the morning and I have to find a physiotherapist really soon to help me to recover. And I can just check on the website at 3 in the night. And it was super easy for me. Don't have to call people waiting for the opening hour of reception of an hospital or something like this. And I also like to have the choice of who I want to have as a physiotherapist. At the hospital, they suggest me someone, but it was 6 months delay and I don't have time to wait for that. And I also want like a young physiotherapist, just finishing the school to give the chance to this word. So it was perfect for me. I found one that I really like and take 20 appointments with her, so it was quite a month.
The first time I used Rosa was to find a really fast availability of a specialist because I had like a fast problem that needed to be taken care of. And so I typed it into Rosa and I really had a choice on schedules that I could find first availability. It didn't matter which hospital, but I really had a choice on first to come, first serve, and I could book my appointment right away.
One of the challenges and one of the value we can provide to hospitals is because using online booking, even though it might seem counterintuitive, actually reduces waste in appointments. Hospitals faced a major challenge with having many patients not showing up, not warning, not cancelling. And while they were thinking that online and dehumanization of appointments would lead to people not caring, the numbers, surprisingly for everyone, us included, shows the opposite. It's twice better. So it means more value for people, you get slots shorter. It's really just a way to make a current system more efficient.
Rosa is a non-profit. Rosa basically is very collaborative. Rosa wants to improve the life of patients. That's our mission. And because of those three elements of values, we actually found huge resonance with our hospital partners. They really saw us as peers in how we wanted to change healthcare, in how we operated, and doing this without sacrificing values such as compliance or security or respecting people's privacy. So our focus for the moment is to continue to grow our marketplace and add more and more patient application features. We believe in a world where patients will be able to manage their healthcare from their smartphone. When hospitals saw how easy it was for patients to book online in their hospital environment, they basically said this is the future of how people are going to be booking at the hospital.